Well, this healthcare tax law, otherwise known as Obamacare, is already denying access for seniors to doctors who do not want to take Medicare patients because the reimbursements are less. I'm hearing also from hospitals that are saying this is going to put them out of business. I heard from a gentleman who had heart surgery, and his cardiologist said he's getting out of the profession. He's just going to go into medical research. And so the approach that we ought to take is not more dictates and more taxes, trillions in spending, trillions in higher taxes on small businesses, on even wheelchairs. There's a 2.3% tax being imposed on wheelchairs. What we need to have are more personal, affordable, and portable approaches, such as health savings accounts. So say as a young person, you start working, you own your own health insurance policy, you move from job to job, you don't have to worry about a pre-existing condition not being covered because you own the policy. Another thing that would be a great idea is allow small businesses to band together in larger pools across state lines and get more competition and choice for health insurance, and therefore more affordable health insurance. I also think that for long-term care, that people ought to be able to use their IRAs and 401ks for long-term care insurance, so that our mothers and fathers or grandparents don't have to lose their homes and their assets if they need assisted living. There is one provision out of this health care law that I think should be reinstated or kept in, and that is allowing children up to age 26 to stay on their parents' policies. The job market is so awful right now for young people that it's better that if they're on a parent's policy than being on no policy at all. And so that's one aspect that I think can be reinstated. But other than that, I want doctors and patients making healthcare decisions, not some bureaucracy panel appointed by the president or political appointees making healthcare decisions. Healthcare is a very personal issue, and if say our 75-year-old mother is talking to a doctor who says we can do a procedure on your aching back that'll make you more mobile and with less pain, the decision ought to be between our mother and that doctor, not some panel in Washington to do that procedure.
The Affordable Care Act is already benefiting millions of Americans. Now there's things we can do to make it even stronger, but as an example, millions of young people are now able to stay on their family insurance policies from the age of 21 to 26 because of the Affordable Care Act. Women can't be charged different insurance premiums because of the Affordable Care Act. Youngsters and increasingly adults will not be able to be turned down for insurance because of a pre-existing condition because of the Affordable Care Act. Seniors are getting lower cost prescription drugs and free preventive care under Medicare because of the Affordable Care Act. These are some examples of really important advances. About 635,000 Virginians got rebate checks this summer because their insurance companies overcharged them. That was because of the Affordable Care Act. We need to keep these improvements in place, and then work to find continued solutions, especially to the area of health care costs. We spend more than any other nation on health care, about 18% of our gross domestic product. The next highest nation is Switzerland at 11%. And we need to find ways to save more so that both families and businesses can find coverage in a way that's affordable.